Go ahead and get started with Colorado Center for Aging, our Voices on Aging Town Hall. We're so excited to kick off this first one of these this morning. And we have a poll question for you to start because we sort of know where you're from because of the registration, but we would like to know what you are involved in and sort of how you came to know about us. So if you want to go ahead and do the poll question that is in front of you, whether you're a service provider for an organization that serves older adults, maybe you are a government employee or elected official, maybe you are a volunteer working for an organization that serves older adults, or maybe you are just interested in these issues. But go ahead and fill out that poll, and that'll give us an idea of who we have here today. My name is Andrew Davies. I'm the Executive Director of Colorado Center for Aging. We welcome all of you here, but for our official welcome, I want to hand it over to Phil Cernanek. He is the President of the Board of Colorado Center for Aging, and he's going to tell you a little bit about himself and CCA, and he will also introduce our first speaker of our town hall. So if we have—
Good morning, everyone.
Yeah, go ahead, Phil.
My name is Phil Cernanek, and as Andrew mentioned, I'm president of the Colorado Center for Aging. I'd like to appreciate all of you for taking some time to join us this morning. As we look at going forward, certainly the Colorado Center for Aging has been very busy. We've been researching issues, meeting with legislators, advocating, and trying to stay true to our mission of raising the voices of older Coloradans. As far as the agenda today, I want to mention that we'll first have Jarett Hughes, who's the Senior Policy Administrator on Aging to the Governor. He will talk for a while, but he'll also be in a position to answer some questions, and those questions you can enter through the chat. In addition to that, Rich Morrow and others will be talking about some of our legislative and advocacy activities and being in a position to deal with those and to raise awareness around those issues. And then Andrew will come back. He'll provide some vision and also directions that the Colorado Center is involved in, as well as facilitating some town hall conversation that we will be having during most of our last hour as we go on. So with that, I will introduce Jarett Hughes. Jarett is someone I've known for a number of years now, as he was involved with the Strategic Action Planning Group on Aging at its inception. And last year, just about a year ago, he took the position to be the Senior Policy Advisor on Aging to the Governor. He is someone who has been around Colorado, have heard many voices as far as issues, as well as thoughts for the future in regards to both services for aging and how to leverage the vitality of older Coloradans. So without further ado, I'll turn it over to Jarett for his comments. And again, enter your questions through the chat. Jarett?
Thanks for the introduction, Phil, and good morning, everyone. It's a pleasure to be here today, and I'm glad the folks have asked me. I can't say enough about the organization, Center for Aging, and its previous iteration, the Colorado Senior Lobby. I think without belaboring the point too much, I know personally and professionally have gained just so much knowledge and insight through being a member of this organization and being a partner in this work. And I think kind of that partnership component is probably something that I will be touching on a few times kind of throughout my conversation, because I think while, technically I might be sitting in the governor's office and an opportunity to lead a lot of this work, we cannot do it alone. The state cannot do it alone. We really rely on our partners in community-based organizations and local governments to really help drive and lead change across our state in this space. So I just really kind of want to make that clear and, give credit where credit is due, and just happy to see where the organization is going and headed these days. So again, just thank you. I kind of like to try and start off, I like this quote. I think it touches on not only kind of the obvious demographic shifts that we have going on, not only in our state and our country, but around the world. But, it touches on kind of the economic impact and the workforce impact and the intergenerational components of this work. And, one of the things that I often say is that, aging does not occur in a vacuum. It is not inherently something that is only age cohort specific. I think that is often how we end up thinking about it and talking about it. And that's how kind of we have developed kind of culturally and as a society. But from my perspective, and I think kind of from a human development lens, it really is kind of, the experiences in our 20s and our 30s and our 40s that impact our outcomes in our 50s and 60s and 70s and 80s. And as someone who is in their mid 30s, who spends a lot of time thinking and talking and planning around this work, I have benefited immensely from the relationships and friendships I have with folks who are 20, 30, 40 years older than me. This is something that I have kind of been around and involved in from a young age, spending a lot of time in assisted living and memory care, kind of on my own family's side of things, but and then kind of moving into this space professionally. But I think that we all have to do it together, kind of, again, this kind of partnership component. And I think what I see a lot of, and I don't think this will surprise anyone, but in media and social media is a lot of pitting generations against one another. Something is like this because someone did it before us, so we have to be upset at them for it. When instead, when we have aggregate problems, we need to work together to solve them in ways that make sense for older generations and for younger generations. Because we know that Colorado is growing older proportionally and in real numbers. So I always kind of lead off with some demographics just because that's kind of the basis for this work. Here you kind of see the clear trend that we are seeing between 2020 and 2025. And then here you see kind of this clear trend in real numbers. And so what I kind of like to point out here is something that I just refer to as a demographic switch, if you will. So statewide in Colorado, 2023 is really kind of when this switch happens. There will be more adults over the age of 60 than Coloradans under the age of 18. This has never happened before, and it will really become our new normal as we move forward. So the Department of Local Affairs and the State Demography Office project out to 2050. And if I had a really, really long slide, then I could have shown you all the way to 2050. But what you would have seen is the discrepancy between 1.42 million and 1.66 widen. So this isn't just kind of a snapshot, kind of a one-time deal. This is something that is longitudinal and will be occurring over the coming decades. So with that, the goal and kind of the mission of this work is to really kind of acknowledge the reality that our shifting demographics will impact not only state policy, but also the private sector in our economy, as well as local government and nonprofit and private sector operations at the local levels. So with that, my kind of overall mission in this position is to really lead policy development and agency implementation through this demographic lens. And through kind of the administration priorities, I'm very much focused on addressing health disparities, workforce development components, and healthcare related issues that ultimately will support aging in the community. Those demographics have a very, demography in and of itself, looking at cohorts of populations and trying to understand behaviors and understand systemic outcomes is fairly predictable in a way. There's obviously nuance and individual variability, but at the aggregate level, we know that there are certain things that will be happening and that we have to do better to plan around. I think we are taking steps in the right direction, but we have a lot of work to do. And I will be the first to admit that. While, on the previous slide, I kind of laid out what my mission and goal is, and Phil mentioned this at the beginning in the introduction, but prior to my work here in the governor's office, I was working with the Strategic Action Planning Group on Aging. And through that work, generating recommendations for the governor's office and for the legislature and for state agencies. And so now really kind of my responsibility is to implement and operationalize that work. How do we take that next step? There's a lot of great planning, a lot of great conversation and discussion that has been done, but how do we move that forward? And again, I will say this, we cannot do it alone at the state level. Rich will talk about some of the projects and priorities that CCA is working on. And that is the type of kind of collaborative bundled partnership that we have to move the needle on this work. At the state level, and really, well, just across statewide, our initiative and kind of brand for this work is Lifelong Colorado. And integral to that work, I think, and well, I'll back up for a moment. I think, Lifelong Colorado at its core is really an umbrella of strategies that involve state policy, regional efforts, and local efforts. It is the logical next step in line with work done by the Strategic Action Planning Group on Aging. And it really kind of addresses the multifaceted kind of dynamic nature of this work, because, aging in itself is just, it's a human development process, but there are these systemic impacts and these systemic outcomes associated with it. So we have to look broadly and look widely across state agencies and the local levels to really kind of identify where best to kind of have those interventions and where best to problem solve. So I'm not going to dive into the detail of each of these components here, but I just wanted to show this illustration that I think kind of captures what I'm trying to talk about. So, at the local and regional levels, and I guess just to note, this is by no means comprehensive. Again, if I had, big, giant, massive slide to show you, I'd be able to do that. But these are just components that fit in here neatly. So, at the local and regional levels, we have all these types of planning efforts. Those inform state agency efforts and state planning. And then within Lifelong Colorado, those seemingly unrelated efforts become kind of synthesized and organized in a way that we try to make sense of. Because I think that what I often hear from folks, and I think one of the things that we have talked about for years, is that so much of this planning seems to occur in a siloed way. It seems like everyone's kind of in their own lane and moving in their own direction, and maybe not kind of crossing over and talking as much as they should. The reality is there always has to be some sort of compartmentalization, but we have to find those points of integration to synthesize this work and make it all make sense together. So Lifelong Colorado is that vehicle and that entity to bring together public health and the Department of Healthcare Policy and Financing and local affairs and transportation and labor and employment, and bundle it in a way that supports adults across the lifespan and into later life. So while this is kind of, on the planning state capturing side of things, at its core and at, the local government strategy and local organization strategy inherent in Lifelong Colorado is specific to livable community and age-friendly work. So just as on that previous slide, I was showing you information around the area agencies on aging and community health assessments and community comprehensive planning, which is something that, your kind of city planner or city manager, it's like zoning stuff. And all of those pieces ultimately fit into these 8 domains of livability. We have great work going on around our state through the AARP network of age-friendly states and communities, as well as through the Denver Regional Council of Governments Boomer Bond Initiative. So that doesn't matter, we have that going on. Larimer County is a wonderful example. great efforts kind of getting underway right now in Sterling and Logan County. We have projects underway in Los Animas and La Junta and Walsenburg. So this works not only in kind of large urban areas, but it also has a lot of efficacy in small communities and small rural areas. And so I would even say more efficacy, because I think those of us who live and work in this space understand it's very difficult to move the needle in Denver or the metro area, but oftentimes in a smaller community, you could really get the right people together and get the right decision makers together to move this type of work forward. And I think that's kind of, again, this partnership component where we cannot do everything. And, we are really looking to kind of create strategies and put policies in place that really allow our local governments and nonprofits and private sector to be able to thrive and kind of really support this work moving forward. So I'm going to transition a little bit and talk about kind of what we are looking towards in 2022. I think I'm pushing up my time a little bit, and I want to make sure I leave time for Q&A. So I won't dive into too much detail on this. There will be opportunities at future CCA advocacy committee meetings to discuss these items further. So that's really where we can kind of dive into the weeds. But the governor's office and the Department of Human Services are putting forward 2 specific legislative proposals this year. The first of which is very kind of a foundational step in this work from my perspective. And it actually deals specifically with our Older Coloradans Act, which was passed in the mid-60s to reflect the Older Americans Act, which is really kind of our guiding piece of federal legislation. So as my perspective with much of public policy, policies created in a social and historical context that makes sense at that time. We are about 50 to 60 years removed from the initial passage of the Older Coloradans Act. And while certain components of it have been updated over the years, we really are looking to take those next steps in modernizing that work. So that involves bringing it more closely in line with the mission of the state agency as laid out in the Older Americans Act, as well as aligning it a bit more closely with some of the strategic direction laid out by the Administration for Community Living, which is really, again, kind of the guiding federal agency on a lot of this work. And I think, there's a lot of words on this slide, admittedly, so I apologize for that. But I think the piece here to kind of take away is that the Administration for Community Living and the federal government has really indicated that the time is now for health and human service leaders to really kind of take that next step beyond the administration oversight of federal and state funding, which is obviously a critical and core component, but really to kind of take this next step towards serving as strategists, working across state governments horizontally, but then also working vertically with providers and local governments and other nonprofits to really lead this work and modernize our state aging and disability network. So looking to better align kind of our current state statute with some of this direction. And this just kind of captures a little bit of that overview. So that involves, really kind of empowering and giving some autonomy to our Colorado Commission on Aging, expanding the scope of work of the State Office on Aging, and then adding a third part and really defining and establishing responsibility over the implementation of the Strategic Action Plan on Aging and Lifelong Colorado, and reporting duties to the Department of Human Services. So again, there will be time in the future to kind of have those conversations at upcoming CCA meetings. I won't spend much time on this. These are 4 components I just see as common characteristics across states. And right now, we are really focused on kind of those first 2. That's what we're trying to accomplish in this statute. We have great organizations all across our state. And we're also lucky enough to have Next 50 Initiative in this state as a really wonderful philanthropic organization. The second bill that we will be running is specific to something we passed towards the end of last year that Rich was an integral component of, and that CCA was, and Dr. Cog. And so Senate Bill 21290 created a grant program for the area agencies on aging. They created it as a temporary program, which ultimately we all have realized that we need to be able to make kind of flexible investments in our aging network, not only over the next 2 years, but over the coming decades. And so our goal is to go in, modify the grant program a little bit, take away, remove the repeal date, so it's something that we can keep around long term.
Yes, I'm calling to see if you have a certain shoe in stock
goal-
before I drive out
Eric,
there.
Eric, I'm sorry, but you're not on mute, if you can hear me. And so we are looking to go in and kind of modify this program and make sure it's something we can keep around and leverage with further investments in our state aging network. And then, just in closing and in summary, these are really kind of some of the projects that we are involved in that I really do consider kind of steps in the right direction in modernizing our approach to aging and later life in general. So with that, I will stop and I will take a look at the chat, see if we have any questions. And
yeah, if you have questions for the chat, go ahead and put them in. We'll have about 5 minutes. So put them in there. We'll do our best. If you don't have questions answered by the end, hold on to those questions and we'll try to get them to Jarrett in another forum. And he already spoke about our advocacy committee with Colorado Center for Aging. We would love you to tune into that. And maybe that is another forum for where you can get your questions answered. But for now, go ahead and put them in the chat and we'll see what we can do with them.
And Eliza, yes, I will be sharing slides with Andrew and CCA team so they can distribute accordingly. Crystal, yeah. And Nikki has a good question too, and I'll take Crystal's on first. So Crystal, right now, through the state level, and I'd be happy to connect with you offline around this as well, depending on how much information you would like to get, because I actually have been trying to talk more to folks in the real estate space. We, at the moment, are really looking to kind of make or utilize some of our American Rescue Plan resources in the affordable housing space. We are not, I'll just say frankly, we're not going to be kind of overly prescriptive with kind of how that money gets spent at the local level. I think we will be having some kind of specific infrastructure projects and then a handful of kind of green energy building incentives attached to some of that money, which is all available in the governor's budget that was released last Monday. But ultimately, at the end of the day, we have a supply issue when it comes to housing. So we are really looking to kind of incentivize private dollars and leverage local government resources and kind of have a matching opportunities to really kind of turn those American Rescue Plan resources we have that are dedicated to affordable housing into kind of broader development opportunities. And so I think with that being said, I mean, the goal is to kind of try and offset some costs and then to maintain that affordability. So Crystal, I think when the slides go out, my email address is actually on the last slide, and you're welcome to reach out to me on that front. And I will quickly shift. I see Phil has responded to Nikki. But Nikki, I mean, that's a wonderful question is, what age does this actually begin? And I think to Phil's point, the services through the area agencies on aging are eligible to adults over the age of 60. So I think that's a fair number to use. I think the one program that is eligible to adults 55 plus is, I think it's the Grandparents Caring for Grandchildren program. But for the most part, I think 60 is kind of a good range there, but I think it gets into kind of the broader conversation around kind of the arbitrary nature of the number, right? I think there's so much more involved in it. There's a lot of subjectivity. So I guess that's kind of my quick answer to that one. And Eliza, could you clarify in if you want to come off mute real quick and clarify what you mean around the homestead. Are you referring to the homestead exemption, the senior property tax exemption?
Yes, we've been talking about it in El Paso and Park and Teller counties. Like when one of our older adults moves and they've already established the homesteading tax, and then when they they downsize or whatever, and it's almost like they're starting over. So we just wanted to have that clarified and how we can advocate for that to have their tax, whatever percentage they're at, follow them.
Yeah, so I think, and Rich, feel free to jump in here. I think we've all talked a good deal around the senior property tax exemption for years, it feels like. And I think there are limits to what we can do statutorily because it's a constitutional amendment. And so I think in order to kind of have that follow the individual, I don't think we could do that in statute. Is that right? Or would that have to be constitutional? Or it's been a while since I read it.
I think it would have to be constitutional, but that's, as with many of the issues with that program, it's always, the answer includes, but I'll have to check to make sure. I think the other consideration on that is there's been concern among policymakers for at least the last 10 years now about the cost of that program to the state growing rather rapidly. And so many legislators, as much as they support the program, are also concerned about how much of a bite it's taking out of the state budget. So anything you would do to essentially expand it or increase the cost further, I don't think is going to get much interest without also looking at other ways to sort of stabilize how much it costs the state each year.
Well, thanks everyone for the input. I hate to cut things off, but we have a number of great things coming in our program this morning. So Jarrett, thank you so much for your time. I'm going to put a long link in the chat, and it's to sign up for our e-newsletter for Colorado Center for Aging. If you're on our newsletter list, then you will get our newsletter, and it'll tell you when Jarrett will be with us again, and also different ways to continue to ask these questions, which I see in the chat, which we want to get answered. And so we'll work with that, but I'll put that in the chat here. And if you can sign up for the newsletter, then you will have more opportunities to raise those questions. So thank you, Jarrett, and thank you, Rich, for chiming in. And now we're going to move on to some different presentations about what's going on in the life of Colorado Center for Aging. And Jody, I think that you're going to take over and tell us what's coming next.
Yes, thanks, Andrew. So a big thank you to Jarrett again for kicking off our session this morning with a high-level presentation about what we've accomplished in Colorado in this past year and what to look forward to in 2022. I think the underlying theme, as is the theme throughout today's session, is collaboration and working together. And we make things happen when we work together. So a quick introduction, I'm Jody Waterhouse, and my day job is Director of Outreach Programs for the CU Anschutz Multidisciplinary Center on Aging. I also am the Secretary on the board of the Colorado Center for Aging. So thrilled on behalf of all the board members that you've joined us today for this town hall meeting. Now, what we'd like to do next for this portion of the program, you know, we get a lot of feedback from all of you, and we also are reaching out to you to find out how best can we all work together to identify issues that are directly impacting older Coloradans, also celebrate what's really working. Through our Voices on Aging subcommittee, which I hope many of you will consider joining, we are working really hard to reach into communities, both geographically as well as diverse communities, to really put our finger on the pulse of what is happening across the state of Colorado that directly impacts our older adults. And we can't do that without you. So I hope that you consider joining this subcommittee. And some of the work that we've done when you registered for today's town hall is to share a little bit with us about the challenges as well as the successes of what is working in your communities. And we want to take that information and then dive deeper with you to create awareness, maybe build educational programs, and even maybe take some of these issues to legislation for the next session. So in this session, this next portion of the program, we'd like to share a little bit about some of the work that we've done in the past, just to provide an example and framework for this work, and hope that this inspires you to work together to make change happen. So I've been asked to share a little bit about our experience with a bill that we created actually 2 years ago, and that was Senate Bill 158. That was a loan forgiveness program to help incentivize nurse practitioners and physician assistants who become geriatric trained. Due to the absolute dire shortage of geriatric trained clinicians that we have in the state of Colorado, we need to figure out ways to encourage folks to go into geriatric clinical training. And so we worked but with this budding idea of how do we create and how do we become part of an existing loan forgiveness program that incentivizes this particular workforce. And so working very closely with CCA and its board to figure out, let's put together a proposal that we can present to our legislators to see if that is even of interest to them. And fortunate for us, Senator Jessie Danielson was very interested once she read the proposal. And again, this was input from the board, the CCA organization, as well as other community organizations throughout Colorado. And the next step then was to take it to the drafter. And the drafter, again, is a lot of brainstorming and thinking through how will this be worded, how will this be positioned. Then once the bill was formalized and sent through the legislative process, I'd like to really highlight the work where the community really stepped in. First, we had to take a COVID break of 18 months, so that threw a little wrench into the whole process, and then kind of rebuild once we were able to come back to the Capitol and resubmit this bill. And as it worked its way through the legislative process this past year, right at the very end, and we were getting positive feedback all the way, we got an urgent email from the Capitol saying it looks like it's going to be killed. And it threw us a little bit. And so we immediately deployed through the CCA, through community partners, through neighborhoods and communities that were really supporting this effort to make sure that you wrote letters, called your legislators, and testified to support this. And right at the end, it got passed. And on July 6th, we were at the governor's mansion, making sure that Governor Polis signed that bill. And now it's in place, and it was implemented in September. But there's an example of, had we come in just as a sole entity trying to ensure this work got presented to the Capitol and made its way through the process, we would have never succeeded. So I hope this encourages you that if there are issues that you feel could become legislation for this next year, please use CCA as a sounding board. Use our resources. Go through our advocacy training that Rich and Jeanette provide to really help kind of build this effort that we're all collectively working toward. And that is to ensure that older adults age well in Colorado. So I'd like to pass it on to my dear friend and colleague through all of this effort, Rich Morrow, who's also going to share some other insights.
Thank you, Jody. Appreciate it very much. Hi, everybody. I'll just real quick. I'm actually on staff at Dr. Cog. I'm the director of legislative affairs there, but I've also been on the what used to be the Colorado Senior Lobby Board and is now the Colorado Center for Aging Board for I think probably the last 15 years, and have co-chaired the advisory or advocacy committee with Jeanette Hensley the last several years. So I'm also very glad that Jarett went first, because he, as usual, was pretty comprehensive and covered most of the things I wanted to. So this will make it easy for me. And I'd also like to pick up from what Jody was talking about. There are actually quite a few issues and possible legislation that we've been working on or have heard that others are working on for this coming year, that in some ways it's scary because it's going to be a lot going on, but it's also very exciting. And I've said this before to other folks, that this could be the year of aging at the Capitol, with the modernization of aging programs and the Older Coloradans Act, the work Jody mentioned, and we're working on a couple of other issues with her group. We've also been following the Affordable Housing Transformational Task Force and the Behavioral Health Transformational Task Force. Those two were created by the legislature last session to make recommendations on to allocate these American Rescue Plan Act funds. And so we expect to be involved with a number of bills related to those. There's also legislation that we've had some conversations about with legislators regarding safety and residents' rights at assisted living residences. So we may be seeing something on that. We've got workforce issues being discussed. There's also, we'll have a specific example here in a minute of that. But these are just a couple of the examples of some of the issues that we're keeping an eye on. There's discussions on mobile home parks, on broadband, and so forth. And also, I think there might even be a bill on elder fraud issues. So there's a lot that's going to be going on. I'll echo what Jody was saying about, if you're interested in any of these issues, we encourage you, if you haven't already, to join CCA and sign up for a legislative committee or our advocacy committee. And with that, I will stop and pass it on to Janine, and ask you, Janine, to go ahead and give us one of those examples of what's being discussed for the next session.
You bet. Thanks, Rich. And thanks, Jody. So I'm Janine Vandenberg. I direct Changing the Narrative, which is a campaign to change the way that people think, talk, and especially act about aging and ageism. And I'm here on behalf of what is loosely called the Older Worker Policy Group, which recognizes that many older Coloradans do, in fact, intend to keep working, need to keep working, and that one of the things that gets in the way is workplace age discrimination and the lack of strong laws in Colorado to address it. So, and in the spirit of collaboration, I want to shout out everybody who's been involved in this policy group. So Jody, Jeanette, also from Colorado Center on Aging, Pat Cook from Colorado Gerontological Society, Karen Brown, Aaron Kuwick from the Bell, Michael Here, Jim Westcott, Mike Kohler. I'm sure I've forgotten a couple of people, but there's been a working group that has really responded to the call from older Coloradans to do something to strengthen our age discrimination laws. So why is this important? We know during the pandemic that age discrimination in the workplace got even worse. Changing the Narrative surveyed Coloradans age 50 and over last summer and found out that over half, 53%, had been pushed out, laid off, had hours decreased, wages decreased, et cetera. At least a third of them felt that they had experienced age discrimination, and another 40% were not sure, even though when we read their open-ended responses, we were like, yes, that's workplace age discrimination, unfortunately. So what are we doing about it? There are a couple of ways that Colorado's laws can be strengthened. So one, we want to eliminate age identifiers on job applications. So we know that it is illegal to ask someone their age, but it's not illegal currently to ask someone their high school or college graduation date. And for most of us, our high school graduation date is approximate for our age. And so what we've heard from hundreds and hundreds of people is that they don't even get kind of screened in to come in for an interview or something. Right now, asking age is a simple way to screen people out because of age. The second thing that we want to do is really strengthen the workplace discrimination laws based on age so that they're comparable to the laws in Colorado about other forms of discrimination. Let me give you an example. Right now, if you were to win an age discrimination case in Colorado, you could not get punitive or compensatory damages, even though you can get those damages if you win cases against other forms of discrimination. So clearly there's a lack of justice in the current Colorado laws, and that's something we want to strengthen. Related to that is a gap in the federal law and interpretation of federal law right now. So at least 2 federal courts of appeal have ruled that the federal age discrimination law doesn't cover the hiring process, which is when many older Coloradans experience age discrimination. And so we want to clarify and strengthen the Colorado law to make sure that it's clear that age discrimination in Colorado does cover the hiring process as well. So we're working with a coalition of these organizations, more details to come. We are clear on the goal, remove age identifiers and strengthen Colorado's laws. The exact strategy and all the details are, still in that sausage being made category, but really look forward. We appreciate the collaboration, certainly with Colorado Center on Aging and many of you here. And if you are interested at all, I am going to put my email address in the chat, and please reach out to me. Thanks so much. And I think I'm turning it back to you, Andrew.
Oh, whoops, here I'm unmuting. Thanks so much for giving us those tidbits, and also Jody and Rich for telling us what's going on in the life of our state. I'm going to put something else in the chat also, because all of these issues are going to be talked about at some point with the CCA Advocacy Committee. That's where we talk about legislative issues. And if you want to be part of that conversation, and then maybe also a member of CCA to weigh in further, we want you to be aware of that. But there's so many things that are going on that are great that we're going to be talking about. We don't want you to miss out with those. Now we're getting close to our time for our actual town hall, where we want to hear from you. We're going to do some breakout groups, and I will explain that soon enough. But I wanted to, before that, take a moment to tell you a little bit more of Colorado Center for Aging and where we are and what we see for our future. You may have known, this will like 5-10 minutes. And at the end of this, I've got some poll questions. So be ready for those poll questions, because there's a way for you all to be involved in the next chapter of Colorado Center for Aging. You may know us as Colorado Senior Lobby. For 40 years, we were raising the voice of older Coloradans, but that was mainly through the legislative channels and avenues, raising that voice there. We have changed to Colorado Center for Aging. We did that this year, and with that, the scope of who we are. We're still raising the voice for older Coloradans, but not just through the legislative process, but creating other forums for those voices to be raised. And I want to just share with you our vision statement so that you can see this. The Colorado Center for Aging, our vision at this point is this. It is a Colorado where older adults have full inclusion, appreciation, and respect, raising their voice and being heard on the range of issues which will increase their own thriving and the well-being of all Coloradans. So that's what we're all about with Colorado Center for Aging at this point. And like I said, that's raising the voice of all older Coloradans, but it's doing it in more than just the legislative channels. And so I want to tell you about that and a certain idea that we have with Colorado Center for Aging of how you might be involved. And this came out of the information that you gave to us as you registered. When you registered, you talked about 3 successes that are happening with regard to older adults where you live, and 3 challenges. We asked for that sort of input. And there was a revelatory moment for me, sort of an aha moment, when I looked at some of those details. Kelly, you're going to talk about that later, but for now, I'll just say that one of the aha moments was that the list of challenges and the list of successes were basically the same list. That if there is a challenge going on where you are, maybe it is affordable housing. Someone also wrote in as a success that someone is doing something in their neck of the woods about affordable housing. If it's transportation, if that's an issue and a challenge, then someone else said, you know what, in my neck of the woods, they're actually looking into this and there's something that's going on. If it's acquisition to food, and that's a challenge, then someone wrote in that there's something going on where they live, where we're tackling that issue. So it was very heartening to see this list. And it also got me and us thinking in some different ways with a different program that we might start to offer. But before I talk about that idea, I just want you all to give a shout out to one another. I want, if you have someone in your world or some organization that is tackling issues with regard to older adults and older Coloradans, put that in the chat. Right now, I want you to say thanks to those organizations or those people. Or if you just want to clap and we see you and you share your video, or if you've got your reactions on the bottom of your Zoom thing and you want to give a thumbs up or a clap to someone, go ahead and put those things in the chat, because we want to let you know that those of you who are doing good things, we recognize you. We know that you're doing that. We don't want you to feel like you're unrecognized. We want you to know that the work that you're doing is being recognized. And when people wrote in the successes that they're seeing in their own worlds, they may very well have written in your organization as someone that is doing something here in Colorado and tackling those issues and making our state a success for older Coloradans. So great to see you putting those things in there. We don't want anyone to think that your work is not being recognized, because it is. But that brings me to closer to the poll questions that I've got for you, and an idea that we have at Colorado Center for Aging for helping older Coloradans and raising the voice of older Coloradans. And that is this. We have heard of all these successful programs that you all are involved in, which is great. And we thought about creating a Voices on Aging multimedia monthly publication that captures some of that information. We want to raise the voice of older Coloradans, and we've been doing that through Voices on Aging with videos of older Coloradans talking about their experiences, talking about their challenges and their world, and we're going to continue to do that. But to add to that with Voices on Aging, a monthly publication that includes this awesome work that is being done statewide, because we want to share that. Here at Colorado Center for Aging, we've got a certain vantage point, which is really nice. We can see statewide and we hear about what is working here and there and everywhere. And we want to share that information so that certain programs might be replicated in different areas. If you've got something that's helping with transportation in Colorado Springs, and you've got a way that you've tackled that issue, maybe someone in Grand Junction wants to hear about that. And through a Voices on Aging monthly multimedia publication, we can share those things. And maybe those programs can be replicated. And along with that, we have the idea of doing something called best practices groups. If there are groups that are doing similar things, maybe they want to have a conversation to figure out how they can do them even better. In Larimer County, maybe you have a farmer's market and you're using that produce to give to older adults for food acquisition. And maybe they're doing the same thing in Alamosa. Wouldn't you like to talk to one another in a best practices group so that you can do those things even better? And maybe someone else in the state wants to be in on that conversation so they can hear about how to create a similar program. So we want to do best practices groups. And of course, also we want to do those people-centered stories where older adults, older Coloradans can share their experience and their hopes for their situation. So these are some of the things that we're thinking about with regard to raising the voice of older Coloradans. We'll continue to do it in the legislative ways as we did as Colorado Senior Lobby through our advocacy committee. But we have this idea of doing Voices on Aging publication so that we can have more conversation going on and best practices groups so we can have more conversation going on. So all of that to say that we're going to put some poll questions up, and we want to know if you find value in this and if you want to see these things happen. So go ahead and do these poll questions if you would. The first one, would you view or read a monthly Voices on Aging multimedia publication to be aware of what's going on in the state of Colorado and what programs are working and what successes are happening? And just so you know, this would not be a long publication. We know that everybody's time is important, but there's too much great information to share. And then the second question is, would you participate in a Voices on Aging publication and the best practices groups? Would you contribute to that? Because it's not just about us finding those things, but it's about you giving us your stories so we can capture those stories and so that we can publicize them. So if you want to go ahead and do that in the poll, that would be great. Because guys, like I said, the aha moment was there's so much going on. Yes, there's tons that we need to do, but there's so much that we can share in order to better the great state of Colorado that we all live in. So we'll give you just another second to answer the poll question. And I will introduce our sponsor, because we want to give our sponsor some time. A moment for our sponsor, Sherry Heidvogel. She is with Kaiser Permanente, and we thank her for being with us today and for her organization. So I'm going to hand it over to you, Sherry, and you can tell us what's going on in the life of Kaiser in Colorado and with regard to older adults. So go ahead, Sherry, if you're there, and tell us what's
good morning.
going on. Good morning to you.
And thank you, Andrew. Good morning to all. I am honored to be able to sponsor this town hall meeting today on behalf of and to represent Kaiser Permanente. So first of all, a question for all of you. What is an objective of a dried grape? Anybody? This is when we need to be in person. Raisin awareness. And just so y'all know, you're welcome to use that. So in addition to participating in today's town hall event, I'd like to help in raising your awareness of Kaiser Permanente. As you may or may not know, Kaiser Permanente has been in Colorado for over 50 years and is the largest nonprofit healthcare provider in Colorado. We offer the highest rated Medicare plans in Colorado and have earned a 5 out of 5-star rating from the Centers for Medicare and Medicaid Services 9 out of the last 10 years for these plans. Kaiser Permanente utilizes a patient over profit model with a focus on prevention and encourages members to be involved, invested, and proactive rather than reactive in their own health and well-being. We partner with members in their total health, collaborating to help them thrive, creating communities that are among the healthiest in the nation. Kaiser Permanente exists to provide high quality, affordable healthcare services and to improve the health of our members and the communities we serve. A lot of people concentrate solely on the cost of their healthcare plan, and while Kaiser Permanente plans are extremely cost effective, it's the value of the quality of care that we provide that sets us apart and above the rest. It's important to know that Kaiser Permanente is a healthcare organization versus a health insurance company, and is at the forefront of identifying and assisting with barriers and factors that affect people's ability to attain their best life. Things like food insecurity, transportation, housing, and affordable medications. We care, we advocate, we give, we thrive. I'm going to put my contact information in the chat for all of you to have and use. Thank you again to all who have attended today and are raising your voices with the Colorado Centers for Aging. I also hope that I have been successful in raising awareness for all of you about Kaiser Permanente.
Thank you so much, Sherry. And we're so thankful for your support. It's great to hear who you are and to have you here with us. I love the joke, raising awareness. Now we're going to transition to the actual town hall part of our program because we want you to raise awareness of what's going on in your corners of the world. So I'm going to give some instructions here about how that's going to go. Basically, what's going to happen is we're going to go into breakout groups. We're going to divide you. You're going to be into a group of probably around 8 people. There's going to be 3 questions that we're going to ask of you, and I'm going to go ahead and put those in the chat now. I'm going to prompt you every 6 or 7 minutes to go ahead and to do the next question in your group, just to make sure that you get through the questions as best as you can. So I'll put these in the chat. If you want to copy and paste them into your own, onto your own computer so that you don't lose them. But like I said, I'll go back through them and I'll let you know every 6 or 7 minutes it's time for the next one. These groups do not have any pre-planned facilitators. So you're going to be in a group of 8-ish people. And if you've been a facilitator before, just go ahead and take it upon yourself to make sure the flow of conversation happens. Make sure that everyone gets a chance to speak about whatever issue it is, because that's what we're all about. We want everyone to be able to have a voice. Everyone's perspective is important. Collectively, we need to hear all of these things to make great decisions for our state. So go ahead and facilitate with each other as well as you can. There'll be a brief time at the end where we can have people share and have an open mic time. So know that that's coming. If you, of course, that's going to be limited time. So if you have something that you've shared or heard and you feel like it really needs to be captured, then another thing that I put in the chat on the very bottom is an email address, getinvolved@coloradocenterforaging.org. If you want to email us some of these precious comments and perspectives, we don't want to lose them. So if you want to do that, know that that email is there and we want to hear your voice. We're going to start by having everyone in one sentence, and don't go more than one sentence or you'll eat into your time too much. But in one sentence, just say your name, where you live in Colorado, and how you're involved in issues regarding older Coloradans. And then you'll start with question number 1, which I will put, like I said, in the chat. Or it's actually sort of a broadcast sort of thing. So I will get that set up, but Kelly Roberts, she is with Colorado Center for Aging. Why don't you tell us a little bit more about what results we found from people's input when they gave it to us when registering? You're muted, so we will ask you to start over and unmute. There you go.
I would be happy to do that, Andrew, and I am prepared to do that.
Thank you.
So we were just really delighted with the amount of input that we received from people as they registered. As Andrew mentioned earlier, we asked for people to share challenges and successes in their communities. First of all, I'd also like to share that we have people on this town hall who are from up to 20 counties in Colorado. So that's a really great development. As the Colorado Center for Aging, we're really focused on building relationships with people in communities all across the state. So we have counties here from Adams County to Weld and all the territory in between. So let me just give you a summary of the input and some of the highlights that I noted. Regarding the challenges, I basically divvied the input about challenges up into as many as 28 categories. So that there was a pretty big range of challenges. Every community across the state, whether you're rural, urban, frontier, whether you're a smaller community or larger community, it is everywhere. Transportation always comes up. And while there are issues around transportation in all kinds of communities, especially rural communities, transportation for people to get to the grocery store, to get to medical appointments, and to get to things that are more related to social engagement. Another thread was the shortage of provider staff. So I know we're reading and hearing about labor shortages in every industry, and the healthcare and in-home care is having that as well. A lack of geriatric healthcare providers, which Jody mentioned in regards to some of the legislation that could help with that. Social isolation and meaningful engagement. Janine, we definitely heard about ageism and workforce discrimination. Internet access, especially rural. And then the last thing I'll mention is underrepresented populations and underserved areas, the challenges that are inherent to those. Regarding successes, I divvied that all up into 20 categories of input. Some of the successes that were noted were our food programs and delivery during the pandemic. I also was particularly interested in several comments about people noticing or making note of all the collaboration that was occurring between service providers, especially during the pandemic, to make sure that services were being delivered. And so there were partnerships between government, nonprofits, and private sector that made a big difference. Age-friendly communities, heard great comments about that. And I really liked this comment about successes, the knowledgeable base of older adults in my community. And finally, I'll mention that several people from different parts of the state were very appreciative of their regional area agencies on aging for the services that the AAAs were able to provide to people. So that's really just a really quick summary of your input. Thank you so much. What we're planning to do is to compile all that input and transform it into an informational document that we will share with you. And I'm seeing some great successes that were added to the chat, and we can pull those into our compilation as well. So expect to hear from us with more about the input that you shared. And again, thank you so much for taking the time to contribute those.
Thank you very much, Kelly. And thanks to all of you for giving that feedback so that we can collect it and do great things with it. And now we're going to have more time for that with you in your breakout groups. So I'm going to go ahead and assign those. You'll see that you can, you've been assigned one, and then you can enter into it. Once again, introduce yourself, name, where you live, and how you're involved in these things. This will last 20 minutes or so, and then we'll come back for some collective discussion, and enjoy yourself. Hopefully you got to give some good feedback, and hopefully you felt like you were heard. That's certainly what we want for everyone being part of our town hall today. We do have a last poll question that we would like you to answer, to get a finger on the pulse of how you're appreciating this event. So if you want to answer this, go on ahead. Are you more hopeful now after having this experience? More hopeful that older Coloradans will indeed have more of a voice in their communities. So go ahead and put that response in. And that's good for us to know how you're feeling about things. Because this town hall, we want to work towards solutions. We also want everyone to be heard, know that that is part of the process. Raising the voice first. And then after raising the voice and being heard, working towards those solutions. So now, thanks for that input. Good for us to know. We will collect that. And now we want to move on to the very end. We thought that we would do an open mic time, where if you want to share something, then you can, whether it's a challenge, whether it's a success, whether it's an experience, whether it's something you just feel like the group should need to know on the whole. We want to do that open mic time for maybe 5-10 minutes. Instead of just unmuting and talking, that would be chaotic. We would like you to raise your hand, and then I will call on you. So if you go to the bottom of your Zoom, you see reactions as one of the options on the bottom. And then if you click reactions, then raise hand is one of the options there. I've just raised my hand in my own box. So if you are feeling bold enough to raise your hand and raise your voice on behalf of older Coloradans here, we would love to hear what you have to say. I see Colleen Mock. You raised your hand. Why don't you unmute yourself? And in a minute or two, tell us what your thoughts are.
I just wanted to kind of, I'm in the Colorado Springs area, and I work at the UCCS Aging Center, and I just wanted to put a plug into some of the resources that we offer and how it can help ensure people remain autonomous as they age, or as their loved ones age. So we work with family caregivers, providing therapy. We do memory screening on a sliding scale fee, and we do that to where it's affordable for people. And we like to balance and ensure that we give the most accurate information possible so that the autonomy is not taken away too soon, but you're not remaining with too much autonomy in a way that you could have some sort of health risk. So those are some of the services we offer, and I just wanted to put that plug in. Thank you, Colleen. And if you want to put your information in the chat, you can do that. The next one that I saw is Elisa. If you want to unmute yourself and tell us your thoughts from yourself or for your group, either one.
Hi, Andrew. So we identified two things. We had some great suggestions that I wanted to share. One was any of the senior organizations, if they could hire care advocates, because they're feeling that there's a lack of follow-up care after a senior is seen, and just touching base with them and then funneling services to them after you hear, once they're at home. And the other thing that we were thinking about is for CCA, when you do PSAs on your portal, if you can translate them into many languages to reach more, to address the language barrier. And then we could maybe take that off your site. And if we know that that's an issue in our community, if that message is in Spanish, we can so forth.
That's great. Those are good suggestions. Thank you. And I'll talk with you offline about these very things. Nikki, do you have something for us? Go ahead and unmute and share your thoughts.
Yeah, I wanted to share actually a resource because we have been very much at work with the town on helping to write the new comprehensive plan and got aging in community to be a part of the 10-year comprehensive plan. And the issue that we were trying to deal with is how do you turn the age-friendly vision actually into policy and create policy statements. And we came up with two really wonderful documents that will enable other people to talk with their planning departments. And I'm going to put that into the chat because that has really helped the consultants to develop to create the new comprehensive plan. And if anybody wants to get in touch with me to find out how we have been able to work to do that, I'd be happy to share, but I'm putting that in the comp plan right now. I mean, in the chat right now. It's the best resource that I've found in turning age-friendly visions into actual policy statements moving forward.
Fantastic. Thank you for that resource. And maybe we can get that and share it again out through our CCA channels, because that's one of the things that we are very much about. Are there any other comments? Ken, I see Ken's hand up. Ken, why don't you tell us who you are and what you're thinking for us? You're on, there you go. Now you're on.
Yeah, hi, Ken Chapin here. I think this is my third or fourth meeting. Just an update. We down here in Los Animas and Huerfano County have our first municipality that has submitted her paperwork for becoming an age-friendly community. So 5 or 6 months of in the trenches work is starting to pay off. And we're anticipating that that the rest will follow. I want to echo what was just said about the integrating the age-friendly into the comprehensive plan. I'm heartened to hear that, given that that's the approach that we're starting to take down here in the city of Walsenburg, where we haven't yet hired the consultant to do the comprehensive planning, but the strategy is to have all of that work filtered through the 8 domains of livability, so that we can sort of codify that so that the age-friendly nature of the work moving forward includes and transcends and exists above any one administration. So I'm looking forward to that being a real victory here in the coming months.
Great. Well, thanks for the update, Ken. Any last comments before we start to share some action steps and move towards wrapping things up? Any other hands? I don't think that I see any. I am going to put in the chat a final survey for you. Your thoughts about this event are very needed, and that's what is in there. But also the last question that we did for the breakout groups, which is about underrepresented communities, there is in that survey a place for you to talk about what underrepresented communities you would like representation through CCA. So please do that survey. Also included in the survey is we want to, and I have already seen in the chat people saying, when's the next town hall? We want to do these town halls, but make them topic specific from here on, so we can really drill down on some of these issues that we've all brought up. So when you do the survey, you can say, hey, I would like the next town hall to be this issue. And then we can see what people really want to talk about. And like I said, drill down to figure out some solutions to some of these issues that we're all talking about. So in the chat right now is that final survey. So click on that and make sure you don't lose it, although we will keep this Zoom open for many minutes after we finally conclude. I think that at this point, I'll turn it back over to Phil Cernanek, our president, so he can give us some final thoughts. And after that, we will wrap up. So Phil, take it away.
Thank you, Andrew. I'm going to post another link that you don't need to go to right away. It is a link to Pickles comic that was in Sunday's edition, or it's at least dated on Sunday. One of the things that is a personal item of mine is being in a position to also highlight the vitality of our older Coloradans. The CCA has put together a value of older Coloradans from an economic and demographic perspective, but we have lots of folks, as Janine mentioned, that are also looking for employment. But the comic, the basic point is 85% of the world's greatest achievements were accomplished by individuals or groups age 60 and above. And then in the last panel of the comic, it notes that, and I ironed my own shirt on Tuesday. So bit of a smile there, but the point is there's also a lot of vitality, not only among the group that is participating today, but among our older Coloradans. As far as our call to action for the folks that are on this and still participating today is to stay interested, increase your awareness, increase your involvement if you have the capacity, and look for opportunities to both collaborate, share, and partner with others. As far as implementation, it's the legislative process that we're involved in is only a piece of what is needed. Government is not the total answer, but sometimes it's needed to help facilitate. But from my perspective, it's how do we actually integrate our older Coloradans into our community? It's not just dealing with the issues of isolation, but also to have them involved. My father, even into his 90s, would read or be read to by second graders when he volunteered in a local elementary school. And the senior bus actually took a group of seniors there periodically, a couple days a week, I think is my recollection, to a local elementary school to have them involved. Certainly want to welcome folks to join the Colorado Center for Aging. Andrew will certainly post a connection to our website. Also in that website, you'll be able to find a recording of today's event, as well as the panels for Jared's presentation and a collection of some of the input you've all contributed and been part of today. So thank you all for that. Jody mentioned the sausage making that looks like our legislative process, but in January, we'll help make some sense of what you can actually do, providing an advocacy training for certainly this next legislative session, as that becomes clearer to us in the hybrid environment that I expect the legislature will want to maintain, as remote testimony can be facilitated with all the technology that they went through in dealing with the pandemic. So I think that will be good. Jarrett is also working on the revision for the Older Coloradans Act and bringing that legislation forward. But again, aging does not mean and is not a direct correlation to frailty and poverty, but is also connoting issues of experience and wisdom, as well as an element of vitality. And the average retirement age in Colorado has moved up to somewhere close to 74. And so there's a lot of folks that are out there either working or choosing to work in that, not only volunteering. So stay tuned for future town hall programs, as Andrew mentioned. And finally, just want to be in a position to provide a thank you for those folks that contributed or supported our day today. Certainly Sherry and Kaiser Permanente needs to be highlighted, because without them, we can't necessarily bring forward programs like this. And certainly the panel presentations of Jarrett, Rich, Janine, Jody, Kelly, Chris, Andrew, and what they were able to pull together. And most of all, thank you for you all. Your work, your interest is certainly very important, and making time this morning to spend some time with us and to share your thoughts as well as your energy going forward for our older Coloradans. So very much appreciated. Have a great day. Enjoy the Colorado that we all choose to live in. And as you go forward, stay well and stay safe. Thank you.
Thank you, Phil, and thank you, everyone. Just to make sure, going to put the real link to the survey in the chat so that you can survey this event and look forward to the next town halls and being involved. Thank you so much. And I will leave this Zoom open for a while so you can go back through for any of those links that you want to check out. Thank you so much.